Welcome to my YouTube channel. Thank you very much for the subscription. For those ones who subscribed, those ones who have not yet subscribed, please subscribe, put on a notification, and we continue to learn. Today we are going to look at the most common drugs we use. Basically antibiotics we use in the treatment of uncomplicated urinary tract infections. What are urinary tract infections? These are infections that affect your private parts. They are divided into two. We have the lower, which goes to the bladder. We have the lower for the bladder is called cystitis, and for urethra it is urethritis. Then we have the upper, which is pyelonephritis, which involves the ureters and the kidneys. So all these infections they disrupt your urinary function. So how do we treat them? Yeah, for the lower urinary tract infections, the drug of first choice for the first line, we use a combination of sulfamethoxazole and trimethoprim in a ratio of 10 to 20. This drug is the commonly called Septrin or cotrimazole. It has a combination of sulfamethoxazole and trimethoprim. Sulfamethoxazole is going to block the incorporation of palmitoylic acid into folic acid by the bacteria. Then the trimethoprim is going to inhibit what we call dihydrofolate reductase enzyme, thus cutting off folic acid synthesis by the bacteria, which is very vital in their cell wall synthesis. So that is cotrimazole or Septrin. Yeah, in addition to cotrimoxazole, we have fluoroquinolones, and more so the second generation and fourth generation. That is, the second generation we have our common ciprofloxacin. Then in the fourth generation you have moxifloxacin, among other drugs. So it can also be used to treat this infection. Then another category of drug is the cephalosporins, more so cefixime and ceftriaxone. We can also use them in the treatment of this disease. Thirdly, we can use what we call urinary disinfectants. The most common and good urinary antiseptic we have is nitrofurantoin. This one is going to help you clear what we call lower urinary tract infection. Those are drugs. Among the second line of drugs of choice of treatment of these infections, we have our penicillins. Our penicillins, we know these are beta-lactam drugs. They have a beta-lactam which binds on the bacterial cell wall. So we have amoxicillin, we can use Biclox, we can use drugs like penicillin G, that's benzyl penicillin, among other penicillins. We have cephalosporins, fluoroquinolones. They can also be used in that category of second line of drugs. Then we go to the upper tract infections. There we can use carbapenems, we can use cephalosporins, fluoroquinolones, and penicillins.